everyone, Pediatric Physiotherapy for Torticollis. I'm Giri Srinivasan, registered physical therapist, pediatric physical therapist from Edmonton, Alberta. This is my co-instructor and my model, Sophie. Say hi, Sophie. So what is torticollis? How a mother or dad can identify whether the baby has torticollis or not? What are the different types of torticollis? And what can you do as a mom or dad or a caregiver for the child to work on the torticollis? So those are the things we're going to talk about it. And also why it's important, the timing is so important for you to bring your baby to a physiotherapist and how it affects the recovery and other milestones. Those are the things we're going to discuss about today and hope you are engaged and interested to know these things. Let's go. Congenital muscular torticollis, CMT it's called. It mainly happens because the muscle called sternocleidomastoid, which is right here. This muscle is starting from behind this ear right here and goes down, one chunk of them going down to your chest bone called sternum, the other chunk going to the clavicle or your collarbone. That's why it's called sternocleidomastoid. Mastoid is the bone in the top here which get attached. That's a very unique muscle. It has two different actions, right? For example, your right side can tilt your head to the right side and rotate the head to the other side. It has two different actions. That's kind of the reason for some confusions in assessment and treatment of this condition torticollis. So we can talk about it very well. What are the different types? There is muscular torticollis, which is, we talked about congenital muscular torticollis, which is common in 30% of the babies. And there is postural torticollis, which is common in about 20% of the babies. There is nothing wrong in the muscle, but babies kind of try to like to be in one position like that for a long time habitually, and that's a postural one. And sometimes you also get a little mass, like a size of an almond in the muscle, in the sternocleidomastoid. I only have seen only 3 or 4 kids in my last 21 years of pediatric physical therapy practice. It's not very common. It can happen during any trauma during birth, either a vacuum or forceps or even birth canal trauma. It can happen during that time. The fourth type is called benign paroxysmal torticollis. That means the head tilt can change from one place to the other side or one side to the other side. Okay, it's also very uncommon. I've only seen maybe 10 kids in the last 21 years with benign paroxysmal torticollis, and that's due to various reasons. The very important reason, the evidence is the drug Reglan. This drug, whether the child is taking or if the mom is taking, it can pass through the breast milk to the child. It can cause this issue. Okay, and also children with a lot of migraine issues. This is also very common. So we work as a collaborative team to work on this condition. The fifth main cause type is idiopathic. We don't know what the reason is. Sometimes kids are born with torticollis. So we got to work on it anyway. Okay, those are the 5 different types usually. How a parent can identify, does my child have torticollis? I'm going to give you those valid points and the tips how you can identify. Does my baby have torticollis? How you can screen, how we can identify. Number 1, you will see your baby head tilted to one side a little bit, okay? And the angle varies. But if you see the baby head tilted to one side, that's number 1. And you also will feel, because the baby is tilted to one side, there will be in the back of the head, there will be some flatness of the head with no hair. That the baby is putting a lot of pressure on that side. If you see that one side being a little flat with no hair, that's also a warning sign. With the head tilt also is another warning sign. Number 3, baby will have some feeding issues. You will say, oh, baby is latching on one breast, not on other breast. Depends how the head is turned. The tongue movements and the orofacial muscle movements can also be affected because of this mild tilt in there. That's another warning sign. Another warning sign is baby will avoid turning the head to one side. So if you're like this, baby will be like this. For a right side torticollis, baby will be like that. Okay, but baby will not rotate to the right side. Baby will be always, head is rotated to this side. That's another warning sign for you. Even if you call from that side, they won't try to turn. They'll be fixed in this side. Okay. Then another thing is baby will use one hand more than the other one. We are talking in context of right torticollis. There is no world existing here for them, for the babies, because they don't turn to that side. They don't see anything. Okay. They don't gain any experience from that side. So the world is all on this side. So they might use one arm and one hand more than the other side. Even I had a baby once. It's like mom and dad thought the baby has a paralyzed hand. She would not move this hand at all, totally. And it's so surprising, like how she started using it in like 2 weeks after we started the treatment. So that's another warning sign, okay? So we talked about the warning signs, how you can identify. Now, as a parent, what you can do for the babies with torticollis. Number one, when you identify these warning signs, immediately go see a physiotherapist. The timing is very, very, very important. I can't emphasize the most important thing with the child with torticollis is how soon you get the baby to go see a pediatric physiotherapist. If you bring your baby to a pediatric physiotherapist within 1 month, your success rate is 99%, and you can get the baby going already. The duration of treatment would be like 6 to 8 weeks. If you bring your baby to a pediatric physical therapist between 1 to 3 months, the success rate is 89% actually. It will take up to 6 weeks to take care of this baby to get better. If you bring a baby to a pediatric physical therapist between 3 to 6 months, the success rate drops down to 62%. And also the duration of treatment needed for the recovery can be up to average 7.2 months. You see the difference between 1 month and 3 to 6 months? But if you do not bring the kid to a therapist up to 6 to 12 months, if you're bringing in between 6 to 12 months, your success rate is 19%. I'll repeat again, if you bring your baby to the therapist between 6 to 12 months, the success rate is 19%. And it might take 9 months to a year, if possible, to kind of get things going. But by that time, there are a lot of compensatory patterns and things would have developed in the child with negligence and so many other things, poor balance reactions and writing reactions and developmental milestone issues and all those things. So, I think you got my point. I would want to emphasize, if you identify these warning signs, please bring the baby to the therapist as soon as you can. I told you, within 1 month, you got 99% success rate, and we do that all the time. We see about 4 to 5 babies a week here, and now patients are more aware, parents are more aware, and pediatricians are referring on time. So we are getting those babies getting much better in a couple of months, in 6 to 8 weeks. And pediatricians, if you are listening to this, please refer to the physiotherapist, pediatric physiotherapist as soon as possible. And also for family physicians. Your timing is very, very important. And thank you so much for your reference. What are the things parents can do to prevent or to work on the kids with torticollis, congenital muscular torticollis? There is a myth out there, you cannot put baby on the tummy time. The baby has to sleep in the back to avoid the SIDS, sudden infant death syndrome. I understand the importance of that, but supervised tummy time is very important for the babies. You have to put the baby on the tummy supervised at least 3 to 5 times a day. That's very important to prevent torticollis. So that gives a lot of independence for the baby to move the head to side and bring the rotation going very well. And with the mom or dad supervised, and also a baby is enjoying having fun in this to explore. That's very important. The second important thing you can do is limit baby in containers. I'm talking about, it's called container baby syndrome, right? Containers means all the time being wrapped, a lot of time spending in the car seat or in the bouncy chairs or some kind of restrictive places. Babies are meant to be left alone for them to move and explore this world, right? They're not meant to be in contained one position. I understand if the mom is busy in the kitchen, you can put the baby in something for when the mom is busy. Don't leave the baby in those containers for like longer time. That's not good for the baby. Like, we have to avoid the container baby syndrome. Your most important task is identifying that early with the screening tools I told you, and bring the baby to the pediatric physical therapist as soon as possible for some very, very important treatments based on clinical practice guidelines and evidence-based practice. That's very important. And you at home, you got to be really following the home exercise program, what is physio is teaching you. Mom is a primary therapist. We could teach mom a lot of stuff to do. As a mom, you have to do aggressive repositioning and while doing feeding and playing, and when the siblings are playing, how to approach, and all those things you have to do, right? And also parent education, what we are teaching you, and we teach you the stretches, education, everything, which you can implement so nicely at home. So you must be asking or wondering, what would happen if you don't treat it? There are a lot of things can happen. I'll just simply tell you a few things. If the baby is tilted to the side, rotated to one side, if not going to the other side at all, this hand functions and arm functions can be very much affected. And then neck is important for the writing reactions. Writing reactions means when I tilt the baby here, the head has to come this way, okay? Those are the very important writing reactions for balancing and for rolling. Those will not develop properly. And also placing reactions. When it's sitting the baby like this, when they tilt the baby's hand will go like this to protect the baby from falling. That's called placing reaction. That may not develop on one side. And all the milestones will be affected. Baby will not roll to one side, will roll only to one side. There are so many things can happen. It's not only that, the vision, the tracking, and the midline orientation will be affected. Even for the hands, the midline orientation, things will do here, and bilateral hand activities and bilateral reaching activities will be affected. These are things can go wrong, and there's a lot other things can go wrong as well. You can ask, what can I expect when I come to a pediatric physical therapy assessment? Okay, we treat the kids in the private room like this with a great ambience and quietness. We have a lot of toys for the babies. We first assess the baby. We take a lot of history from the parent, birth history and everything. Then assess the baby, see where baby is and do a proper diagnosis and treat the baby. As physiotherapists, we do hands-on stuff, a lot of myofascial techniques, a lot of manual therapy techniques with the baby, and some neurodevelopmental therapy techniques, because I am certified in NDT. I have a post-graduation in basic developmental therapy for pediatrics, for the neurological conditions as well. So we do a lot of neurodevelopmental therapy techniques in here, facilitation of rolling and things depends on the age appropriateness of the kid. And then we teach the parents quite a bit to what they're supposed to do at home. And we'll give them handouts, we give them videos to work on, and then they go home and then they come back. Okay, that's how we do. That's what you expect in a pediatric physical therapy assessment and treatment sessions. I think I gave you enough information about congenital muscular torticollis and how to identify it, what are the types, what can go wrong, and what can do. So, if you have any questions about it, feel free to reach out at Giri Srinivasan Institute of Physical Therapy for your child's pediatric physical therapy needs. It's not only torticollis. If you have a kind of tippy-toeing and developmental dysplasia or any hip dysplasia issues or any pediatric physical therapy needs, please reach out to us at Institute of Physical Therapy. And from here, Giri Srinivasan and Sophia, hi and bye for you guys. Bye.